Well, I'm sure people will wander in, but welcome to Pediatric Grand Rounds. Dr. Hockett was going to introduce today's speaker, who she knows very well, but I'm excited to invite or to have today's presenter be Jennifer Knoll-Folliard, who actually received her bachelor's degree from Purdue University in Human Nutrition, Foods, and Nutrition in Business. She went on to receive a Master's of Public Health at Johns Hopkins Bloomberg School of Public Health in Comparative Health Systems and Policies. And she's currently the founder and owner of her own business called Health Plus Nutrition First, which I hope we'll maybe hear a little bit about today.
Oh, sure.
It would be very interesting. She's currently also enrolled as a PhD student despite being a business owner. And she's working on her PhD at USD in the College of Health and Sciences. And today she's going to talk to us about nutrition security as a preventative pediatrics, aligning systems across South Dakota. It's great to have her here today. She actually was previously with the Department of Health, and has had a long-standing interest in improving nutrition and population health in South Dakota as well as abroad. And she worked for many places, but including the Maternal and Child Health Block Grant Reviewer. You have a lot of long-standing history with improving health and through nutrition in our state. So please join me in welcoming our Jennifer Folliard. Thank you.
Welcome, everyone. Okay, so I was prepping the folks who are in the room that a lot of today's presentation will not focus on clinical aspects of nutrition related to maternal child health. So, but what we're really going to focus on is, again, that aligning systems and policies, specifically across South Dakota. My background, just to give a little bit more context, my background is in policy, specifically public health and nutrition policy. So I was a federal lobbyist for 5 years, and then I do some advocacy, some direct advocacy here in South Dakota now as well. And we'll learn more about that. But I do want to give you a really broad context related to the nutrition safety net and the systems that are at play for your patients that you might be encountering in the clinic. So by the end of the session, participants will be able to describe the scope and drivers of food insecurity in South Dakota, identify key systems shaping family nutrition security, apply a food as medicine systems integration lens as an example of systems integration, and discuss partnership and policy strategies to improve child nutrition security. So before we get started, I do want to just level set on, and I'm realizing that I used different terms that I'm using here in these slides, but these are definitions and measures. So when we talk about nutrition security or food security, that is a population measure, right? So for the last, I think, 30 years, the Department of Agriculture has been collecting this data. And the data really is looking at anywhere from very low food insecurity to marginal to food secure. So there's like, it's a broad scope of how a family is managing their food resources in their family. There's food sufficiency or food insufficiency, also a population measure. And that came about and was used more frequently during COVID-19 because it was a more frequent measure that could be taken to see how families were coping with, a variety of different systems that were sort of in flux, and how was that impacting how secure they were with their food resources. And then hunger vital signs. So this is a clinical measure. And that's what's used on a lot of social determinant screening forms. So it's a 2-question validated question that's in a clinical, like in a social determinants screen. And it asks, again, how food secure you as the patient, if you're 18 or older, or your family is if you're a child. So any questions on those? As a public health professional, I tend to use a lot of those population health measures, and the ones that I'll be using today to talk about utilizing household resources and population resources to address food security will be that food security. Okay. Now, the other definition that I wanted to bring up, and one that is getting a lot of attention recently, is this food is medicine or food as medicine. So again, the term's been around for a really long time, maybe 20 years. But over the last, like even in the most recent Biden administration, there really was an increased focus on utilizing food as medicine. And so really what that means is integrating healthy food into the healthcare system to help more Americans thrive. And that can look like a lot of different things. And we're going to talk a lot about some food as medicine integrations that are going on in South Dakota now. But typically what that means is medically tailored meals or groceries. So, say you have a cardiovascular disease, tailoring your groceries, like it's almost like a prescription. So there are methods and programs and policies that do that. And then there's fruit and vegetable prescriptions as well. Or if you've ever heard of sort of the Double Up program, where you get double the amount of fruits and vegetables if you utilize SNAP. So we'll talk a little bit about that. That's not necessarily always integrated into the health system, but it is something to be aware of, and it is a food as medicine initiative. So the intent is to address increased burden of chronic disease, like heart disease, cancer, and diabetes. So South Dakota statistics, just for some level setting. So data released in 2024. So this was the last time that the USDA in the last 5 months has discontinued that population health survey that's looking at food security that they had been doing annually. So the most recent data that we have is from 2024. And in that, it really did indicate that over 113,000 people in South Dakota are facing food insecurity. And from that, it's 1 in 5 children. So that's close to, I think, I'm doing my math correctly, it's like 32,000 kiddos. And so, just considering that, 1 in 5 of your patients probably that come into your clinic are experiencing that food insecurity. Cancer and heart disease are the 2 leading cause of death in South Dakota. So again, cancer and heart disease prevention and treatment are linked in some way to food. And so that's something to really be aware of, especially when we're talking about food as medicine. And then approximately 38% of South Dakota residents live in a food desert. And this was a long time ago. So it was 2015 that data was most recently collected. But again, when we say food desert, it's a tract where many residents experience low income and have low access to supermarkets or large grocery stores. So, and that's not something that I think we're unfamiliar with, but it does create an extra barrier for folks who are trying to get food. Okay, so one of the things that I will get to talk about later is the South Dakota Healthy Nutrition Collaborative. And in that space, I do get to encounter and work with a variety of different leaders in the health and nutrition space. But I think what's really important when we're thinking about South Dakota specific considerations are looking at some of the opportunities or looking at the challenges and then making sure that we're looking at opportunities. And so I really wanted to, I highlighted 3 different specific South Dakota unique influences related to food and nutrition security, and then also highlighted an opportunity that we have a program that's addressing that. So I am going to have Anna from Extension tell you about her work, but this is one of those special considerations for South Dakota, and that is our geography. So the majority of our state is designated as rural. And when we're thinking about access, affordability, and accessibility to food, that geography and the rurality really can be a challenge. And so one of those challenges are additional costs to get food across the state. Another one is low population density makes interventions to address food and nutrition security hard to scale, right? Because we don't have that many people that are doing the work. And so what I identified here are 2 opportunities, really thinking about locally driven food solutions tied to economic development So when I worked for Extension, right when I moved to South Dakota, and Anna will tell you a little bit more about that in this video that we're going to watch. What I noticed and what I observed was that, so I moved from Washington, D.C., and we don't have family here. We had never lived here. We had no concept of where we were going. And so we just kind of showed up, and I was like, well, I got to learn about this place. And so the best way to do that is to go out and work in, rural areas. And so what I noticed was just how committed the folks who are in rural communities are to keeping their community alive and building off community anchors. And I think one of those community anchors is really food, having food resources in communities, like grocery stores, and then also community gardens and assets that people can. And does everybody know what a community garden is when I say that? Yeah. So like building their community through food. And so I thought that was really very unique to South Dakota and really, really cool, especially when we're spread out, that those community members come together around food. And then the other part that I thought was an opportunity was long-term public and private investments in systems and structures that center food. So while we have these community food solutions that are going on in those very, potentially rural areas, we also at the state level really need to start thinking about how do we support systems that get food to people? How do we support those communities in a way that is a structured state investment? And I think a lot of that can be done through an economic development lens. So I will have Anna go ahead and tell you a little bit about her work.
Anytime a kid gets their hands in the dirt or tastes a new fruit or vegetable, they're more and more likely to grow fond of that fruit or vegetable and eat a variety of healthy foods.
Welcome to the Learning Garden.
Farm to School is a broad term. It encompasses local food procurement, but it also encompasses youth gardens, which we see here in Dupree, and educational activities that revolve around local foods.
Our garden is really a learning garden, and it started as an affiliate of our local YMCA. It's a branch of our programming. We are the YMCA of the 7 Council Fires. And so what happens here is kids from our day camp program come to garden class every day, Monday through Thursday, and we do evidence-based learning that SDSU Extension Office provides for us. And so with that, we try to take advantage of teaching them some of these healthy lifestyle skills. That's not just games, but also working in the garden and knowing how to live a healthy lifestyle through what you eat.
The garden has created a space to learn about STEM topics, to learn about nutrition, to do an art project, to get hands-on exposure to fruits and vegetables, and it's leading to a start of a nutrition education. One of the programs that we offer at SDSU Extension is called Pick It, Try It, Like It. It's an evidence-based program that provides recipes and activities for all sorts of fruits and vegetables that we can grow in South Dakota. And it provides a good way to get hands-on experience and use a little curriculum without having to come up with it on your own.
And the kids, they do everything. They help plant the seeds. They learn where all their fresh produce comes from. They tend the plants, and then we get to harvest and then use them in our cooking. Do you remember where pickles come from? You remember? Cucumbers. Yeah, they come from cucumbers. So all your pickles start out like this. And then what happens is we add like vinegar and sugar, and then it turns into a pickle. Every single night, the kids get a free hot dinner. And so a lot of our vegetables go to that program. And so we're really just trying to do this healthy lifestyle with our kids, which is a core value of the Y, and it really fits into work with SDSU Extension Office.
Studies show that when kids are involved in growing food, they're more likely to try it. So they're more likely to try the cucumber that they grew themselves in the garden than they are to go to the grocery store and buy a cucumber and actually like it. There's a sense of ownership there that makes them more likely to eat it.
All right, which one? I'll let you pick it. Cucumber. How was it? Was it good? You try this one. It's a Cherokee purple one.
In South Dakota, 5 of the top 10 leading causes of death are chronic diseases, which are nutrition related. So programs like this, which get kids exposed to healthy, nutritious foods from the start, are an evidence-based method to get them to continue eating fruits and vegetables throughout their lifetime and prevent chronic disease. When we start thinking about each community across the state and each community across the nation that's doing little garden programs after school or in the summer, and how that impact can seem small on the community level, but we replicate that across the state and across the country, we really have a huge potential to impact the lives and the health of our kids.
Our community is a small one, but we are a mighty community, and we really try to do our best to come together and service kids through our programming here. You can see the benefits in the kids, and you can see the benefits of your community. And so I would say for anyone, it might be a little bit hard to start it, but it's always worth it in the end.
So I don't know if you picked up in there, but Anna did talk about, the chronic disease rate. She talked about evidence-based practice related to engaging kids in the picking, the growing, the trying of food, and just thinking about at a systems level, how do we integrate and bring solutions to communities so that they can have those opportunities, especially thinking about our geography and our rurality. Our next South Dakota specific consideration and influences on food security is food is culture. So cultural health is tied directly to food. So the challenge is the loss of cultural foodways over the last 100 years due to systems and policies that marginalize Indigenous communities. And an opportunity is food sovereignty initiatives. And I won't play this for you right now, but I would highly recommend that you go in and look at some of the tribal food sovereignty work that's happening in the state as another opportunity really to build out that not necessarily food is medicine, but they do talk a lot about food as medicine and food sovereignty work, but really thinking about building those skills and having the opportunity that those systems are there to build the skills around food that have been lost over the last 100 years. And this is Matt Wilson from Sichungu Company or Co. Sichungu Co. And he is just a remarkable human. And I really, again, encourage you all to take a look at the work that they're doing. They have, I think, 3 or 4 different and you can kind of see it in the background, geodesic domes, where they do a lot of growing and cultivating of food that they can eat. And then they also, each of the tribes are also cultivating their own bison herds. So they are going back and trying to reclaim some of those traditional foodways that their ancestors have lived here for many generations. So trying to revive that as a way towards food as medicine. And then the other South Dakota consideration and influence on food security are policy decisions. And one that's really unique that I will talk about later on is this federal to state policy interaction. But then we also have a second additional consideration when we're talking about food, and that is tribal. So tribal governments as well. So the challenge is programmatic and resources distribution and prioritization across 2 forms of representative governance models. So we have federal state, we have our US federal and state government, and then we also have tribal government as well. And then the opportunity is intentional convenings, shared understanding that builds trust towards collective advocacy. So in a very rural state, hey guys. So, hey, in a very rural state, we are spread out. And so I think that trust building across the state will be really important. And that is where the work of the South Dakota Healthy Nutrition Collaborative comes in. And we'll talk more about that as we get further along in the presentation. I'm going to stop. Does anybody have any questions? Is this like a question answer type conversation, or is it more just lecture?
Whatever you want it to be.
Okay. Any questions online?
No questions.
Okay. Great. So I will give just a brief, so when we're talking about policy and systems, I often, and this is very small, so I'm sorry for those of you that can't see it. I will give just a brief nod to the socio-ecological models to give us a framework for understanding, individual food choices and how they're influenced at many levels. And I don't want to say above, but many levels so both policy So family influences what kind of individual food choices folks can have. Community influences and influences families. And then we have systems. So what kind of systems are influencing individual food choices? And then we have policy and environments. And I would say that I have two arrows, one going up and one going down, just trying to articulate that all levels of the socio-ecological model influence one another. But when we're thinking about how to introduce interventions or write policies, understanding exactly what influences what and how it influences is really important. So a good example of that is, I'm going to go to the very top where I think at the systems level, I can't particularly read it, but I think I remember I put in there marketing. And so thinking about different types of marketing that your little ones experience and your family's experience, just thinking about some of the marketing for, and I don't want to call them junk foods, but junk foods in general, those are systems level influences that can be then dictated by policy. So thinking about putting some regulations on marketing junk foods, I guess I shouldn't call them junk foods, but foods that don't have a ton of nutritional value, putting some policy regulations on some of those marketed influences will have influence on what the family purchases and what a child will be exposed to in their home to eat. Another great example of how this sort of all works together is thinking about different policies that influence where resources are distributed. And when I say resources, I mean, like in this case related to food, could be grocery stores, it could be convenience stores, and it could be those community gardens that we saw in Anna's video for SDSU Extension. So all of those are policy decisions, and they are business level decisions if you're putting a grocery store somewhere, but there's always incentives that the government can provide to say incentivize that you keep your grocery store in a rural area, or if in the SDSU extension case, that is a federal policy that funded that program so that Anna could go in and do the work that she was doing at SDSU extension. So all of those different resource allocations about what a community has in their back pocket as far as food resources, a lot of those are then tied in some way to a policy decision. So again, this model just sort of depicts that when we're thinking about interventions for both families and individuals and communities, that there's influences from policy all the way down to the family and what they're and how they're choosing the food and what's available to them to choose. Okay, so this I'm going to go quickly, and this we could spend a lot of time here, but I think it's really important. You all are coming from a public health and healthcare lens. There is also a whole other food system that your patients and your families that you're working with are engaging in, and you as a person are engaging in, right? We all need food, so we all are engaging in the food system. But I think what's missing in a lot of didactic education around health is like what this food system actually looks like. What does the food safety net actually look like? And I'm just going to run through this briefly. I did have Notebook LM make me some like beautiful graphics of this because it does get rather boring. But I will just run through it briefly because I think it is important when you're talking to a family and they've screened positive for food insecurity. You know yourself as a clinician what is available to them as far as resources. So again, there's 16 federal nutrition programs. South Dakota runs 14 of them. Some are direct monetary assistance, some are charitable food assistance. All of them have some sort of eligibility standard. So, and that eligibility standard is typically around income. And then there are some that are that are what I call supportive environments in education. So they really are working on those policy and systems levers to make sure that you have opportunities to buy affordable food, or you have access to healthy food. Okay, so this is my lovely AI graphic, which I really love. I think they did a nice job. I tried to lay it out. So this comes from a public health nutrition book that I wrote the policy chapter on. So I'm not feeling too bad about using AI in this case because I wrote the chapter and I just needed a graphic. So when we're thinking about different federal programs, thinking about it across the life course is really very, very important. So there are different programs that will be available to like the maternal child health population that is not available to an over 60 population and vice versa. And so kind of following along, this is kind of a cheat sheet on which programs are available to who based on the life course. In general, I would say SNAP, so the Supplemental Nutrition Assistance Program, is the baseline for all. Okay, so there's no age limit and families from 0 to 100 can get SNAP. So this is our primary safety net for food and nutrition security. And this does have an income eligibility. I'm gonna go through these pretty quickly. On the tribal reservations, you can also have, instead of SNAP, you can have, it's called the Food Distribution on Indian Reservations program. So it is a box of food versus getting a SNAP benefit card, which is like you run it at the grocery store. Another commodity program, and this is what Feeding South Dakota distributes, is the TFAP program. So that is also like if you were to go to any church food bank in a very small community, this federal program probably supplied much of the food that is in that food bank in your very small community. Incentives, so laying on, when I talked a little bit about the Double Up program before, providing incentives for fruit and vegetables, this program is also run through USDA as well. So if you have a SNAP card in some states, not in ours right now, but in some states, if you have a SNAP card, you can get a Double Up program where it will double your amount for fruits and vegetables. Say you spend $5 on cantaloupe, you get an extra $5 to spend on, cucumbers, tomatoes, whatever, another fruit and vegetable. WIC, and our pediatrics folks will probably be very familiar with WIC, also income eligible, and WIC is a prescription program. So it is the first food as medicine program, and it is based on nutrients of concern that are not included in women and children's diets from prenatal to age 5. And some people ask, what's the difference between WIC and SNAP? WIC is that prescription, right? So we can say that at a population level, these nutrients are not typically available, or they're at a deficit for women, infants, and children. But SNAP, again, because it's from 0 to death, there's no prescription prescribed. There's no way to identify how to identify nutrients of concern in that large of a population. WIC extension, so breastfeeding peer counselors, and the South Dakota WIC program does do a great job with breastfeeding peer counselors. They also, they're always recognized in the nation as doing such a great job with that. We do not have the farmers market nutrition program for WIC in our state. This is the child and adult care food program. So this is another federal food program that runs through daycare centers, emergency shelters, and after school programs. So that snack at the library that your kiddo's getting after school, that is probably a CACFP program. School lunch, another core program. And this is also income-based, and it is also prescriptive. So the nutrition standards that are offered here are based on age, and they follow the child from kindergarten all the way through 18, and they change as the child gets older. The income eligibility is at 130% of the federal poverty line, and then at the reduced price, it's at 185% of the federal poverty line. And just for some reference points, Medicaid is about 130% of the federal poverty line. So your patients that, well, I guess for children, it's higher. For children, it's higher. But for parents who are on Medicaid, it's about the same income. Okay. Beyond the cafeteria, some other enrichment programs, the fresh fruit and vegetable program, the special milk program, and farm to school. And we heard a little bit about farm to school. I know this is sort of boring, but I do like it is good to know sort of when you see food programs in your communities where they're coming from. So congregate nutrition programs and then home delivered meals. So those are the Meals on Wheels for our senior citizens in the state. Both of those are also federal programs. They do not have necessarily an income requirement, but the community-based organizations that run them are able to target lower income seniors. And then the commodity supplemental food is that senior box program that Feeding South Dakota runs, where they deliver a box of food. It's a monthly box that they deliver to senior citizens. And then our state does not have the senior senior farmers market nutrition program as well.
I guess that is interesting to me. I don't know if you can comment a little bit more, because it seems like that would be a win-win for supporting local farmers.
Yes.
So there's the
great.
I'm also new to the state. So
yeah, great question. Well, to me, like, so there are administrative costs in running both of those programs. I think for both WIC and the Senior Farmers Market Nutrition Program, the question is the demand there? I think that's been the response. So supply and demand, like, are there enough farmers markets that would accept this program? And would people utilize the program?
Can you do it like just in Sioux Falls?
Yep.
Or do you have to do it in a certain like number?
No, you can. You can. Great question.
So what is the impact then to the people that are selling their produce at the farmer's market? Just out of curiosity, because I've always lived in South Dakota, so I'm not familiar with this program.
Yeah, I mean, they would, depending on what they were selling, it would just be like, so like, I don't remember how the senior program works, if I'm going to be honest, but the WIC program, it works very similarly to like, I don't believe you get cash, but it is sort of like a voucher, I think. Don't quote me on that. I sort of put it out of my mind because I was like, it's not here. Yeah.
Yes, I mean, and it's probably 10 years ago, but I've seen some of those at a farmer's market in Nebraska. And essentially they're like, I think they were like wooden, but they're like chips that they like, if they're
I think so. That could also be a double up program too.
Yes, it was also.
Yeah. I think it might be is it on the EBT card? These are great questions. Yes, go ahead.
In Iowa, it's voucher.
It's voucher. Yeah. Yeah. Okay, that's helpful. I wonder if they'd move to EBT though. So I don't know. Those are good questions. Okay. So I kind of bucketed them into three different things. So financial incentives are SNAP, WIC, the Senior Farmers Market, and then that double up program. The like where you're getting food in like a box or you're getting it on a tray. That's the school lunch program, the senior box program, the tribal program, the CACFP, TFAP, and then SNAP-Ed, FNEP, which I didn't really talk too much about, but that's nutrition education, WIC peer counseling, and farm to school are in that education component. So when you have these slides, you can have this little decoder as well, because the alphabet soup is wild. And then we're kind of back to this again, and just really thinking about when we're thinking about food and nutrition security, some of those different programs that work specifically for populations that you all are serving. So specifically WIC, the school meal program, and then just always thinking about SNAP as the base for everybody across. Okay, so when we're thinking about, so I wanted to go over and just set the context for this food system, right? So again, those 16 federal nutrition programs, and then we didn't even talk about any state specific programs that are going on in the state, but those are the system, the food safety net system, similar to in the healthcare space where you have Medicare and Medicaid as the healthcare safety net system. Now, when we're talking about food as medicine or food as medicine, integrating those systems, and then we have to bring on sort of that social safety net too, those social programs as well. How does integrating all that in a clinic can be very challenging. And so when we're thinking about what that looks like, we are still in the phase where we're testing a lot of those types of interventions. So, and I've noted them here. South Dakota State University does have that double up program. So they are working with Bowie Foods in the southwestern part of the state to really to double people's SNAP dollars. And as they come in and get fruits and vegetables, then they can buy an additional, whatever, like I said, $5. The study that's going on at Avera right now, and Dr. Hockett is leading that, is that food as medicine study. And that really is that prescription component to this work. I think what is important is that when we're testing these types of interventions in a clinic, recognizing that there's an entirely other system that needs to be integrated in to that clinic and to with that person and that patient, just recognizing that the complexity of both that health and the food system can be somewhat overwhelming for the people who are doing the intervention in the clinic, but then also for your patients as well. So they are doing a great job studying it, and I'm sure that Dr. Hockett would be happy to give you some just preliminary results of what they're finding. I will also again mention here the South Dakota WIC program. That is they've been doing that since 1978. That program's been around, but they have been doing that connection from clinical to community to food, because food WIC does provide that food prescription package. Yes.
Question, Jennifer. So in addition to, I'm such a research nerd, I'm sorry. But in addition to studying the outcomes on food security for the population that is in need, are they also studying the effects on the community? So when you mentioned like Bowie's, I've been there many times. It's, you know, there's grocery store in Gregory, there's places. But then does that also increase the the amount of fruits and vegetables that are fresh and available in their grocery stores? So they're studying those outcomes too?
Yes, they will study that. And I know that Dr. Bastian is studying that at Extension for sure. They're really trying to understand the impact that that's having on the availability, like to your point.
Yeah, like a benefit to the community.
And anytime you talk to a grocer, they will tell you, like, we'd prefer to sell fresh food because the margins are higher. Right. So the margins are higher on an orange than they are on like a Coke. And so they know that that's improving their community health in general. And so I think that is an argument that will be made and has been made, that it does benefit not only the people who are utilizing SNAP and that double programs, but also other community members. Yeah, it's a great point. Okay, so just briefly, I did just want to put in here, so food as medicine, who's involved? So you have healthcare providers, you have food and meal providers. So if they're doing those medically tailored meals, so someone's having to provide either the meals or the groceries, they're collating that. Retailers and grocers, health plans and payers, so who's paying for this? And we'll talk a lot about that. Community organizations, so in more urban areas, they do sometimes have food delivery associated with some of these interventions. And so there's like a whole delivery aspect to food as medicine. Researchers and then those technology partners. So you have a lot of different sectors working together in this food as medicine integration. So opportunities for sustained change. So again, solutions are still being tested. The complexity is very real. I think it's very intuitive, I think, for us to conceptualize that, yes, food is medicine. Giving people healthy food will result in better health outcomes. But I think what you've seen, and hopefully I've demonstrated, is that there is work to be done in that integration spot. And then the other sort of opportunity I'm going to call for sustained change is that funding right now is really very grant-based. And so again, in this food as medicine space, there's fragmented reimbursement. So Medicare and Medicaid do cover this type of work. Again, with federal changes, that has sort of been put on hold for new programs trying to come into this space. And us as a fee-for-service state, generally we haven't seen that type of work being done in fee-for-service states. Again, I put in there sort of where it's happening elsewhere in the country, so you can kind of see that. But right now, the work that's happening in our state is grant funded, meaning that it is meant to test that integration and those solutions, but thinking about sustainably, how do we cover that? There aren't a lot of federal mechanisms for our state to be able to do that. And you'll see here, policy and federal guidance is really uncertain in this space right now as well. The other opportunity, I think, is that private and employer coverage. So thinking about both Sanford and Avera health plans and how maybe they might be able to cover this type of work in the future. So and I know we're getting closer to time and I want to leave some time for questions too. When we're thinking about addressing community food solutions and those clinical interventions to address food and nutrition insecurity, and we're geographically large and we're very rural, there is, I think we've seen some momentum in this space, that there really needs to be requires a shared vision and advocacy to communicate sort of what's working in some of these other communities, and to then use that as a best practice and a launching pad to build some of those other community food solutions. And so this was my final, and I brought this slide back, but I wanted to talk a little bit more about the South Dakota Healthy Nutrition Collaborative as that convening to align systems towards that shared vision, knowing that we have additional considerations in our state, and that we have to communicate across a wide area and two different sets of government. And so how do we do that, right? How do we do that? And so really the South Dakota Healthy Nutrition Collaborative has pulled together close to 40 partners. Many of them are community-based partners, but we also have the research entities. We have the public health school or the health sciences school. We have all three of the major health systems. And then we also have some commodity type groups. So we have the Dairy Association, or the Midwest Dairy, excuse me, and some of the ag producers as well. And really the intent of this group is to create that shared vision and shared momentum so that we are thinking at a state level and we're acting at that community level. So, and we're sharing what's working in some of these, in some of the communities. So we're broken up. This group started about 2 years ago. And we're broken up into 3 different groups. One is working on the identification of research, the evaluation and promoting programmatic best practices. The next is really elevating folks that have experienced food and nutrition insecurity and making sure that their voices are at the table. And then the last is to advance policy implementation, really for that sustained change. And in our first year, I think I feel like we've done a good job. We're about 1.5 years in, but we've really gained commitment, we've built awareness, and we've grown. And so some of the work that's been happening really is, a lot of the work that's happening is like, okay, we all are doing some sort of food work in the state, or we see the value in doing food work. How do we come together? And how do we want to organize ourselves? So in that first year, that's really what we did. I feel like we met a lot. We had a lot of meetings. We identified a purpose. We had those shared goal groups. We identified a structure. And really we started down the path of like, okay, how do we systematically move this forward? Like, how do we have our purpose, we have our goals, how do we move it forward? And each of those goal group, like leaders in those goal groups have been absolutely amazing. And I will get to that. This is also very small, but in those goal groups, in our first goal group, we were doing a landscape assessment. So what we recognized is that each of our different programs and each of the smaller communities had their assessment done about what's working in their community, what's not, what are the gaps, what are the challenges, what are the opportunities, but we did not have one at a state level. And so that was kind of our first like, oh boy, like we have to get this done so that we then can rally around finding solutions to the gaps the state has identified. So over the last year, we've fundraised and continue to fundraise. And we have a Vera Research Institute and the Center for Prevention of Child Maltreatment running that landscape assessment. And there will be an opportunity for you to engage in that in a minute. And so hopefully by the end of July, beginning of August, we will start releasing that assessment, and it will be a dynamic document. The Department of Health has decided and has committed to bringing that internal. So we are doing the initial assessment. Department of Health will then turn that into a data dashboard that everybody can use and kind of will live on in perpetuity. We're hoping. And so we are really excited about that. And in July, we will have that assessment done. Goal group 2, that goal group, we're still working on making sure that we're elevating folks that are in decision roles that have experience with food and nutrition security. And we're working on a project, hopefully that will come out in summer, but more on that later. And then the last is policy implementation. And this was the first year that we've been able to do what I would say like grassroots type advocacy and then grass tops advocacy. And I can talk a little bit more about that, what that looks like, but we have a policy priority document that all of us have in the policy group have agreed on, and with a consensus-based model. So we all had to agree, which was a 2-year long, it's like a 1.5 year long process to get to that point. And so I feel like we've got sort of that structure developed in order to, we've got momentum going and the structure's developed so that the momentum can sustain. Did you have a question? No. Okay. So here's the landscape assessment survey. So if you can, I should have put the QR code bigger, but you can either click on the link or you can get that little QR code, but we are looking for survey respondents. So I think I heard yesterday we have close to 300, but we need more. So we are not represented in every county in the state. And so we need more people. So please do take that survey. It will be open until March. And again, the findings from that, the statewide landscape assessment will be at the end of July.
So it looked like the QR code pulled up the email address. So should be
No.
Yes, sir.
Okay. Well, I will get you
the red cap thing.
Okay, I will get you the can I send it out with the
I
slide?
can send it to
Yeah.
to the department and we can send it out then broadly to the attendees.
Amazing. Okay,
Okay.
we will do that. Thank you. And so again, that landscape assessment will be the foundation that we start really moving on, right? So and when I say we, again, it's those 40 organizations collectively moving together. They're individually also moving, right? They're also continuing to do their own mission, but they have that shared vision and shared commitment to continue to work together. And this is just our role in that. So alignment, making sure that we're all aligned, and that action equals advocacy. So knowing that we, 1, can't do it alone, and 2, that we're going to need to convince other people that the work we're doing is important and should have investment behind it. And so that alignment and action will equal advocacy. And this is just from our webpage. Just our role in this work is really around education and advocacy for sustained change. And I will say, like, for our first year I think we have 6 different priorities. 2 of those priorities actually were debated this session, which is just amazing. The school lunch bill had been around, I think this is its 4th year, but it was really awesome to be able to really support that work and support the coalition building that Representative Whitman had done. And then HB 1147 is an indirect response to the loss of the local food procurement program that was paying farmers, that Feeding South Dakota was then paying farmers to give them local foods to then distribute. So HB 1147 is in direct response to that loss and the loss of some of those TFAP dollars that Feeding South Dakota did not receive based on the new administration's decisions. I guess it's not anymore, the Trump administration's decisions. So that both of those were discussed. They're still up. I would highly encourage that you engage around both of those and hope that we're still in the process. They're still churning and deciding whether they're going to move forward with those or not. And is there a question in the chat?
Your survey link was just put in the chat.
Amazing. Thank you. Okay, so what's next? So thinking about where we go from here, like it's kind of been, I think I've been using the word bootstrapping a lot lately. We are bootstrapping funding for the landscape assessment. We are just like building and flying and building and flying and building and flying. And I think when we get that done, I think we're going to be able to really utilize that to push for more sustainable changes, either at the state and possibly at the federal level too. So, you know, what we know is coming, value-based payments are coming to South Dakota when TBD, but they are coming. And when that does happen, you know, food could be a big part of that. Knowing that food is really can be used in prevention and treatment of many of the chronic diseases that we see in our state. Knowing that other states are utilizing food as medicine interventions in value-based payments is something that we could consider as well. The Food as Medicine Officer, Department of Health, so there was a recent call for food as medicine officers in state agencies. And so potentially that would be an opportunity at the Department of Health. Community food solutions that continue to work. So really thinking about and making sure that we're sharing some of those best practices and those community food solutions with other communities statewide. Again, the landscape assessment will focus the South Dakota Healthy Nutrition Collaborative even more than it is now. And then really putting this out into the universe that 5 years from now, there'll be a food systems plan in South Dakota that we all are sort of behind and we're moving towards. So your engagement is essential. So please join the South Dakota Healthy Nutrition Collaborative listserv, and I can get that information to you all as well. Take the survey, and we'll get that information to you. Ask questions about how to engage in your community's food solutions as a provider. So as a clinical provider, all of these solutions are happening in your communities. Food banks, food pantries, your church food lady that's like making sure that she's got her pantry stocked for people that need to stop by. All of those are food solutions that are happening in I would say in all of the counties in South Dakota. So engaging in that as a health provider you can be a really strong advocate for those types of programs. And then join a professional association advocating for these types of initiatives. That's that.